Today, we're taking a close look at what happens when your own body declares war on one of its most essential tools. Yeah, we're talking about the rheumatoid hand.
Just think for a second about what your hands do every single day. They build things, they create, they let us communicate. They're pretty much our number one way of connecting with the physical world around us.
But what if your body's own defense force, your immune system, got confused and turned against them? What happens then?
To really get a handle on the rheumatoid hand, we've got to start at the source of the problem. And that's a disease called rheumatoid arthritis, or just RA for short.
So, what is RA really? Well, it's a chronic autoimmune disease, and that word, autoimmune, is the absolute key. It's basically a case of friendly fire. Your immune system is supposed to protect you, but it gets its wires crossed and starts attacking your own healthy tissue. And it has a real preference for the small joints in your hands and wrists. And, get this, it often hits both sides of the body in a mirror image or symmetric pattern.
So how do you know this internal attack is even happening? Well, some of the classic first clues are pain and swelling in the knuckles and wrists on both hands. People often talk about this deep, intense stiffness in the morning that can last for more than an hour, making it almost impossible to even make a fist. And doctors even have a special word for how these joints feel: boggy.
Okay, so that's how it starts. But as the disease goes on, it can leave some pretty visible evidence. So let's take a little tour of the most characteristic changes RA can cause in the hand.
Our first stop is one of the most recognizable changes you'll see. It's called ulnar drift.
So what exactly is going on here? Well, just looking at it, you can see the fingers start to angle out, slanting toward the pinky side of the hand. The mechanics behind it are actually pretty wild. The ligaments holding the knuckles in place get weak. This lets the tendons that straighten your fingers slip right out of their normal groove. You can almost picture it, right? It's like a bunch of ropes jumping off their pulleys. Suddenly they start pulling everything sideways. And the real-world impact? A major loss of grip, making it hard to hold something as simple as a can or a glass.
All right, the next stop on our tour is a deformity that's named for its very distinctive shape, the swan neck.
With this one, the middle joint of the finger actually bends backward too far, while the very tip of the finger bends down, creating that unique swan-like curve. This all happens because a critical ligament on the palm side of that joint gets loose, and it just throws the whole balancing act of a tendons completely out of whack. Functionally, this makes those small, precise tasks, like buttoning a shirt or picking a coin up off a table, incredibly difficult.
Now let's look at the literal mirror image of the swan neck. It's called the boutonniere deformity, and when I say they're opposites, I mean they are perfect opposites. Where the swan neck's middle joint bends back, the boutonniere's bends forward. And where the swan neck's fingertip bends down, the boutonniere's bends back. The difference simply comes down to which exact part of the tendon structure gets damaged first by all that inflammation.
You know, we can't really talk about hand function without giving special attention to the thumb. The most common RA-related problem it faces is called the Z-thumb deformity, and its impact is just massive.
And why is it so massive? Get this, your thumb is responsible for somewhere between 40 and 50% of your entire hand's function. That's almost half. So when it collapses into the Z shape, with one joint bent back and the other forward, the ability to pinch and grip things is just devastated.
So, okay, we've seen what the damage looks like from the outside, but what's actually happening deep inside the joint to cause all of this? Let's zoom in and take a look.
The whole path of destruction in RA really happens in three main stages. First, you get inflammation. The lining of the joint gets angry and swells up with fluid. That's called synovitis. Next, the body starts to form this aggressive tissue called pannus. A good way to think of it is like an invasive moss that just starts growing all over the smooth, healthy cartilage of the joint. And finally, this pannus doesn't just sit there. It releases enzymes that actively eat away at the cartilage and even the bone underneath it, which leads to all that instability and the deformities we were just looking at.
Now, seeing that whole path of destruction can feel pretty grim. So the obvious question is, how do we fight back? Let's talk about the modern counterattack that's used to try and restore function.
The modern approach isn't just one single thing. It's a multi-pronged attack. The absolute foundation is medical therapy. We're talking about powerful drugs, things called DMARDs and biologics, that are specifically designed to calm down or redirect that overactive immune system. Then that's backed up by conservative care. Things like physical therapy and special splints to support the joints. And finally, for cases where a lot of damage has already been done, there are surgical options to help get some of that function back.
When it comes to surgery, surgeons and their patients face this really fundamental choice. Do you want to prioritize motion or do you want to prioritize stability? One path is arthroplasty. That's a joint replacement, which aims to restore movement with a new implant. The other path is arthrodesis, which is a joint fusion. This procedure gives up on motion by fusing the bones together, but the result is a stable, pain-free joint. It's a really significant trade-off.
So, where does all this leave us? Well, I think the most important thing to take away from all this is a message of real hope. The development of modern medical therapies has been an absolute game changer because doctors can now step in earlier and more effectively right at the immune system level. Those severe, really debilitating hand deformities that used to be so common are now seen far, far less often. And that really brings us to our final thought. The fight against RA is at its heart a battle for control inside our very own bodies. So the question we're left with is this: as science keeps moving forward, how can we continue to turn the tide in this internal fight? Not just for RA, but for all autoimmune diseases.